Thank you again for staying with us on your radio experience. You can count on the program is Eagles Outlook. And like I mentioned before, we would be talking about, the National Health Insurance Act signed into law by the president just last week. And the bill, or the act as it is now, would require Nigerians to pay a one-cover tax on calls. And that's what Nigerians are worried about. Some Nigerians who already know about it are worried about it. But then people are saying, well, this is a good thing for, the vulnerable Nigerians, those who are, who are poor, who cannot afford healthcare would be covered from our taxes if Nigerians are taxed. At least 83 million other vulnerable Nigerians who may not be able to afford healthcare, out-of-pocket healthcare expenses will be covered by the taxes. All of this we'll be looking at all of the benefits of the National Health Insurance Act as signed into law. My guest again this morning is Mr. Israel Akinwesi, who is a chartered accountant. He is the past ICANN Press chairman. He's going to be joining us on the program this morning in a bit. But before then, let's get talking. The federal government has slammed a new tax on phone calls in the nation to fund free healthcare for the vulnerable group in Nigeria. This is despite recent moves by telecommunication companies to increase the price of their services as a result of an unfavorable operating climate. The telecom tax is an equivalent of a minimum of a kobo per second for phone calls in parts, which is a part of the sources of funds required to finance free healthcare for vulnerable groups in Nigeria. This is contained in the National Health Insurance Authority Bill 2021 signed by President Muhammadu Buhari last week. The tax is one of the sources of money to the vulnerable group fund to subsidize the provision of healthcare to the group, defined to include children under 5, pregnant women, the aged, physically and mentally challenged, and the indigent, as may be defined from time to time. According to the Act, the Vulnerable Group Fund is money budgeted to pay for healthcare services for vulnerable Nigerians who cannot pay for health insurance in a bid to subsidize the cost of provision of healthcare services to vulnerable people in the country. Well, just to help us understand this, and even in advanced countries, there's healthcare insurance for vulnerable people, and that's what this act seeks to, establish in Nigeria. But most Nigerians are concerned about the fact that they would be taxed again. And seeing as how even telecoms operators are saying they want to increase the tariff for calls, it would mean that if the tariffs go up, your tax may also go up. Because at the moment, the telcos charge about 11 kobo per second. So if that's increased, say, to maybe 13 kobo per second, which is, at the moment, what we're being charged, what the tax says is 1 kobo per second, which is going to be like 9% of what we currently pay. It would mean that if the tariff goes up to maybe 15 or 13 kobo per second, we're also probably most likely going to pay more taxes on that. But is that supposed to be a concern if the vulnerable group would, get free health care and medical care by this act? What other people are concerned about is the fact that we've seen situations where monies go missing, people are taxed, Nigerians are taxed, and at the end of the day, the people who are supposed to get the free health care are not captured. Others are worried about how, we're going to go about getting the numbers or getting these people who we claim to be vulnerable group. The physically challenged, the pregnant women and aged people, and the children under 5. How are we going to register and know that these people actually cannot afford the health care out of pocket? Would it be like the indigent people's register, where people are saying they don't even know who's captured in that register? We just have numbers going up in that register. Would it be true? Would it actually serve the purpose? That's what many Nigerians are concerned about. We would be talking all about all of this when my guest joins in, but in the meantime, you can join in with your 2 cents. Call me on 090-7353-0044. 090-8766-8888. Will the vulnerable Nigerians actually benefit from this, or would it be another conduit for people to siphon money? That's what many questions. That's one of the many questions Nigerians are asking. Okay, join the conversation. Let's hear from you. 090-7353-0044 or 090-8766-8888. You may want to send me a message on 090-9705-4450. That is 090-9705-4450. Okay, let's talk. Getting this caller in. Hello, good morning.
Good morning.
Thank you for joining us. What's your name?
Destiny John.
Say again.
Destiny John.
Destiny John, good to have you. Let's hear you, please. Go ahead, let's hear you. All right, seems like you're not ready to talk. Hello, good morning.
Good morning.
Good morning. Thank you so much for joining us. Paul?
Happy New Week.
I wish you the same. How's it going?
This is one of the determinant weeks in the history of Nigeria. We are waiting for primaries and so on and so forth. So, I want to say that this policy of taxing the telecoms lines for it to be used for insurance for vulnerable. In the first place, when government wants to introduce this kind of policy, people need to understand what the definition of the vulnerable and what category of vulnerables are we talking about? Because from our own experience, that's the same thing they're doing with what do they call this woman's ministry?
Ministry of Humanitarian Affairs.
So now they have not been able to define all these things to us. Because you say you are feeding the less privileged, you are feeding schools and all those things. We have not been able to understand what those things are doing. Because right now, if you say you want to tax 11 naira or 11 kobo to be diverted to insurance, I don't understand, because these things, there's no clear cut, there's no clear definition of all these things for us to understand. If you are taking 11 naira, I hope somebody is not planning to use that money to his own pocket. Because most of these things that we see government bring up, at the end of the day, it ends up in private pockets. People just use them without even having cause to have sympathy for these people that have been mentioned on this program or the policy. Because if you say you want to take 1 naira, it's the same thing with the police subsidy. It just seems like that.
Okay.
You are giving subsidy and people are taking the money into their pocket without supplying the fund into this country. So it's the same thing with this one.
All right, Paul. Thank you very much.
My friend, another thing I want to ask from you, please. I wanted to discuss something with you, but I need your number, please.
Okay, just send me a message on WhatsApp. Send me a message. You have a WhatsApp number?
Yes,
Send me a message on WhatsApp. I'll talk to you from there.
Thank you very much.
All right, the conversation continues, and I have my guest joining us. My guest, like I told you earlier, is Mr. Israel Akinwesi, who is a chartered accountant and the past chairman of the of ICANN. He's joining us this morning. He's been working with the health sector as as a financial expert. Joining us this morning. Thank you so much for joining us, Mr. Akinwesi.
Thank you. God bless you. How are you?
I'm very well. Now, let's first talk about the fact that one of the sources of funds for the national health insurance for the vulnerable group would be taxation of Nigerians, telecoms tax, which is at about 1 kobo at the moment. What are your thoughts on that? Do you think Nigerians can handle more taxation as the inflation, has continued to increase?
Thank you for adding me to your program this morning. The truth is that the Nigerian government, in our own assessment, is not doing enough. Increasing taxation people who pay to fund the health insurance program in Nigeria. It will be a right in the right direction if there is going to be transparency. But the truth is, just like what has happened to the Education Trust Fund, which the government created in order to fund the university system. But we all know that the university system itself is already underfunded, even when companies are paying substantial funds. So if the government has come up with a program of funding the national insurance scheme by increasing taxes paid by telecom and other sectors of the economy, how are we sure this money will be channeled towards this health insurance program? So we can assume that even if government has decided to be transparent enough and to be honest with Nigerians, the truth is how many of these people in Nigeria are actually covered under the national insurance health scheme. Only very few, less than 20% of the Nigerians actually have gainful employment. So what happens to those who are artisans, those who are peanut sellers, those who are market women that do not even have access to good facilities? So, in my own mind, the government has to go beyond taxation. First, they should increase the infrastructure, the health challenges, the facilities in the health sector itself has to be improved upon, and the qualification of fake drugs must also be blocked, must also be removed. So, it is only then the government can now assess how much they actually need by imposing taxation. So, for me, government has only used that as a means to make more money for their to finance their own expenditure program. Because in my own mind, what has gone to the presidency and even the Senate, the lawmakers, that area should have been flushed first to make some savings before government will come back to say he wants to increase taxation on any other sector.
Well,
so I just hope that.
The telecommunication tax is just one aspect of the funding. There are other options to the government to fund this. The National Health Insurance Authority, also the Vulnerable Fund. One of such is the Basic Care Provision Fund. To the authority, the Health Insurance Levy. That's going to be there. That's another one, and then the telecommunication tax. Money that may be allocated to vulnerable group by federal government. There's also, donations and grants coming in from other, supporters.
That's exactly what I'm saying. Bringing funds together to finance that health insurance scheme is something good. But the question is transparency in the disbursement and management of those funds. How much do you think NCN will pay, for instance, telecommunication tax towards that program? It is on record that since 2022, MTN had paid on paper. We saw it on newspaper that MTN paid about 735 billion by way of taxes to federal government for year 2021. And I know that the education tax will be over 50 billion out of it. So the money coming from these sources are not channeled appropriately towards the program they have been earmarked for. How are we now sure that these telecom taxes will also go towards resolving the problems in the health insurance? So all I have submitted this morning to you is government should do enough by being transparent, by being accountable, and by being honest, and to show that the starting point is not just that they are contributing. Government itself should have taken the health insurance as a priority. But the truth is, the senators, the House of Assembly, all of them, all these people in the presidency, what they take out of the economy is substantial enough. So they should have looked back into those areas and reduced substantially their expenditure profile. So the funds they are able to generate cannot come in. It is them. You should be able to call on these private sector organizations to contribute money. But asking the private sector organization without reducing your own expenditure profile, I don't think it's the right policy in that direction.
All right, we will be talking more about this because we see that the National Health Insurance Scheme, which has been repealed by this new act, has only been able to capture about 10 million Nigerians or so from the last check in 2021. And it would mean that over 180 million Nigerians are still outside the national health insurance net. So how do we...
We're not sure that the public taxation or not, even if you increase the tax to 100% of your turnover, how are we sure this money will bring in this 100, even less than 20 million? If over the last 5-6 years you have said the statistics of government is only 10 million within that system, then how are we sure additional 20 million will come in? But to even trap in this 20 million, it's going to cost a lot of money. So the second point is whether there is health insurance scheme or not, let facilities be on ground. The private sector, the medical doctors, the private hospitals or whatever, they are part of the healthcare system in Nigeria. So, but the policy of government is too discouraging into all those ones. It's not favorable. So government should look into the policy direction rather than taxation, rather than raising money. To put money together is important. But the truth is, who spends that money? How do you spend it? Are they accountable? Will you hold them responsible? We know what has happened to National Housing Fund. We know what has happened to a pension fund. We know what's going to happen also. We know what has happened to education fund. We know also what we are already assuming what also happened to that healthcare fund. So how do they hope that the government will be more attentive and proactive in their thinking?
All right. We'll be talking more about the benefits of this, of the new act signed into law. We'll be talking about that in a bit. Stay with us. The conversation continues here.
Eagles 102.3 Abuja.
It's travel time. 3 lucky people stand a chance to win a trip to Kenya in the Techno Nigerian Idol Winner Trip promo. Buy the Techno Camon 18 or Phantom X smartphones and travel on an all-expense-paid trip with the winner of the Nigerian Idol Season 7. Also, get discounts of up to 10,000 Naira on select Techno smartphones and gifts upon purchase. Promo runs till 5th of June. Visit at Techno Mobile NG on social media for more info. T's and C's apply. Techno, stop at nothing.
Eagles 102.3 Abuja. Abuja.
I can tell it's been lying and pretending that it's faithful and he loves you.
Hanging out with friends is such a hobby, but chilling with your girlfriend? Such a bolster. We talk about love, family, relationship, the shady, hilarious, fun, juicy, messy gossip in town. And the gentlemen aren't off the table. Girlfriends with Olije, Mondays and Fridays at 1 p.m. Exclusive to Eagles 102.3 FM, Abuja.
Eagles Morning Rise. Eagles Morning Rise with
Kehana Prince.
9:34 is the time. You're on to Eagles Outlook, and this morning we're discussing the National Health Insurance Act signed into law by the President. The act is supposed to have at least targeted at 83 million vulnerable Nigerians getting free health care and subsidized health care if all Nigerians are get registered in, with the National Health Insurance. But then one other thing that's got my attention is the fact that the federal government has made health insurance compulsory for all employers and employees. So if you're an employer, you have to make sure that your staff are registered with the NHI. That is the National Health Insurance Authority. Get registered, and as an employee yourself, you have to get registered and pay, subscribe to the National Health Insurance Authority. Now, I'm going to ask my guest, Mr. Israel Akinwesi, chartered accountant. Do you think that this is possible to have all Nigerians, especially employees, subscribe to the National Health Insurance Authority?
It is not practicable. Because you look at Nigerians, over 80% of Nigerians live in rural areas. How do you go down to all these remote places and bring them together? It's good you have said the presidency is targeting all employers of labor. how many Nigerians are employees? How many of them are employed? In Lagos State, how many people in Lagos, on the street of Lagos, how many people on the street of Ibadan are gainfully employed? So if the government is targeting those who are employed and encouraging the employers to take up such a education assurance health insurance, well, it will, to some extent, when you impose penalties and harassment and coercion, at least substantial number of employers will comply. But what about those who are non-employees? What of those artisans? What of those who don't even have jobs? To come to Ikeja this morning now, you see over several dozens of people roaming about. Nothing, no work. You go to Oshodi now, you go to Abuja now, you go to Enugu now, you go to Kaduna. Several people roam about on the street, no work, no employment. So how do you capture something? So, in my opinion, it is impracticable to have all Nigerians. But if they are targeting 80 million Nigerians, I doubt if they will ever get that one. So, but what they have put up is a projection, so that I will not be a prophet of doom. I can only hope that more Nigerians, because there are advantages in taking such a scheme, but how many of them actually know this? So, mass education, awareness, publicity, use of local government machineries to reach the people, all these will be necessary if they want to achieve that target.
Now, I heard somebody was suggesting that if we really want to take healthcare seriously and the insurance, we could do something very small. Say, for instance, all Nigerians, especially the vulnerable and poor, having to pay just the token of maybe 100 naira to see that they can afford healthcare at the end anytime that they fall sick. Because someone is saying it is not every time that people fall sick, and when some people are sick, some others are very healthy. That if we were able to have a situation where instead of having Nigerians pay so much on account of health insurance, we could reduce the amount, because health insurance is quite beneficial to the populace. Saying that if we can do at least 100 naira for all Nigerians, then in the long run, we would be able to raise funds to cater for the sick and even vulnerable in the society. What do you think?
I have said it at the beginning of this discussion. Asking every Nigerian to pay 100 naira or 200 naira or 300 naira is not the problem. When this 300 naira on 200 million Nigerians come in, nobody gives of this money, and who is going to account for that money? At the time you fall sick, you go to the hospital in your village, your locality, and they tell you there are no drugs. They tell you have to pay 2,000 to obtain card. Then the question is, why have the government collected 100 naira from you at the beginning? Because this money, once they are put together, is under the president, under the watch of somebody. Accountability becomes important. I think the solution is this. If the government actually wants every Nigerian to have access to quality health facilities, why not go to the various local governments? Mandate them. There is what we call direct intervention. Equip these community-based hospitals. Increase capacities in these various clinics at various levels. Encourage private medical practitioners by way of subsidy of some of their drugs, of their equipment. All this will go a long way in making the cost of administering health programs cheaper. People do not go to hospitals because of the exorbitant cost they charge. And I will not blame them. I have a client that has to borrow 40 million to buy an equipment. And before you know, they couldn't generate enough money. The bank has to come and harass, and because the property was used as collateral, the bank is threatening to take over that property, including the equipment. So in such a situation, the man will have to hike up his prices. So what government should do, asking people to pay is a good thing, but transparency becomes the issue. Government should go and equip all the various clinics and health facilities at the local level. This will enhance the dispensation or the delivery of healthcare at a cheaper rate. And with the mass awareness, to create such awareness, then people will go and get this healthcare. Why should the house seller on the street of Abuja make more money than the government hospital? Because the house seller is in this people. The house seller sells at 20 naira, 30 naira, 40 naira. Whether good or bad, whether fake or genuine, people patronize because of price. It's only the educated ones that know they should go for such a medical checkup. Why do herbalists thrive in Nigeria? The herbalists make money because they believe that people believe they are not only easily to be reached, but the prices are cheap. So government should not think about bringing money, or there is no relationship between the government funding or through what to collect from people and the healthcare system. People do not patronize these government hospitals either because they don't have enough capacity or because the prices are too high. So government should go in, equip the facilities at the local level, support the local government system, support the various state government, the private institutions in the healthcare system should be encouraged. Some of their assets should be, the equipment should be subsidized heavily, taxes on them should be reduced. Then the drugs should be sourced from the right source. Even those who produce the drugs, the pharmaceutical companies, they should also be encouraged. Funds should be available at cheaper prices, at cheaper rates. All this will go down to increasing access to quality healthcare in Nigeria.
Very well said. Join the conversation now. What are your thoughts? We're talking about the National Health Insurance Authority Act signed into law by the president last week. We're asking, would you be able to pay? Would you be able to afford more taxes? Would you be willing to pay more just to see that the vulnerable in our communities and in our societies get full health care, get access to good health care, as we are targeting full universal health coverage by 2030 as a country? I'll bring in a caller now. Hello, good morning.
Good morning once again, my friend. How are you?
Very well. Mayo, I'm glad you're here.
Mayo, yes. They said a healthy society is a productive society. On that note, I want to be poor on the vulnerable Nigerians enroll on the National Health Insurance Scheme. If we, the vulnerable and the poor, we also contribute to the health care of themselves and their family, I don't think there is anything that is wrong with that. However, what is the guarantee that the money, when put together, will be utilized for even the medication or medicaments, drugs, and the rest of it will also be available in the hospital, just as we are witnessing currently. We are running a national health insurance now, but most of the time when you go to the hospital, they will still write to a paper to go and buy the drugs yourself. Then, what is the essence of doing it? With the other side, they talk about tax on fuel, that whatever they recover from the tax that you are paying when you are buying fuel will be used to maintain roads. Which road are you seeing that is being maintained? Look at National Housing Fund that the workers are contributing money to. When they retire, they find it tough to get what they are saved. All these things, if you have to look at them, you will see that there is that distrust about that gap between the people and government because of the antecedents of government when they make promises or when they say something they never keep to it. Like our guest said, look at education tax. 2% is taken from a company on the basis on the accessible profit. And this money, you can hardly see this money is diverted. And all these things, put them together, how will Nigeria trust government? I think it is important for government to go ahead and provide all this infrastructure. Let people see that when they go to public hospital, they will be able to enjoy quality health facility. Then with that, I think Nigerians will be willing. I will be willing to contribute to that fund.
All right. Thank you very much, Mayowa, for calling. You too can join the conversation. Call 09073 090-530044 or 090-8766-8888. Send a message to 090-9705-4450. It appears that Nigerians may not have a problem paying for health care and, insurance if they are sure that their monies would be, adequately used to provide such services. Like you rightly mentioned, Mr. Akinosi, you talked about accountability. You mentioned that we've seen where all these monies, especially from education, trust fund, and the rest of them, go to. At the end of the day, they're not being utilized. As a chartered accountant, what can you tell us about accountability and how we can ensure that these monies are used? We saw what happened with the accountant general is being quizzed at the moment. Before you respond to that, though, I would like to bring in a caller. Hello, good morning.
Good morning.
Good morning. Thank you for joining us. What's your name? The network did you in. Try to call us back. Now, Mr. Israel, tell us about the Accountant General of the Federation is with the EFCC. At the moment, we have seen situations where people who are made to, account for the nation's wealth and funds are said to be, what do you call it now, the hands in jar with our funds. At the moment, as a chartered accountant, how do you think we can go about securing the nation's, wealth and funds?
The starting point of the problems of the government is the budgetary system they adopt. The budgetary system, the budget of last year is 400 naira. This year, they tell you they're going to spend 500 naira. Nobody ever sat down to tell you what did we achieve with 400 naira. And what are those specific things you will want to achieve with 500 naira? So in incremental budgeting, which Nigeria is using, there's a problem. But there's what we call program-based budgeting system, which in US they use. You tell the government comes out and says, okay, the health insurance scheme, in 2024, we are targeting 40 million Nigerians. And for us to achieve this, in this state, we're going to build an hospital. We're going to do this, we're going to do this, we're going to do this. You outline them. And accountability starts from when every 3 months or every 6 months, a panel of people, independent of the government or inclusive of government functions, functionaries, will visit each project site and assess whether it was actually true or not that you have expended this money. You tell people you want to build an hospital in Okigwe to take care of masses in that area, and you have represented it's going to cost, say, 30 million. After 8 months, people in that locality plus the presidential official should be able to visit the site and assess whether the job done is commensurate with the money you say you have spent. But in Nigeria, it is never like that. Even the Accountant General or Auditor General of Nigeria, I don't know human beings. They are my professional colleagues. I salute them. I appreciate them for the work they are doing. But the truth is, the system they operate has already handicapped or has already come in as a handicap to their job. Government system, the budget system is not. So to ensure accountability in that area, government should be able to specify what they intend to achieve, what they intend to put up, and what or the number of people they intend to they are targeting. So every 6 months, there must be an appraisal process where people will go. It's not just the presidency alone. It's not just the Auditor General alone. It's not just the accountability. What the Auditor General is doing is actual paper or that the paper is placed. So you give a contract of 20 million to somebody and you say you have disbursed 18 million. Then 18 over 20 is substantial. At that point, when you have already spent 18 million, the project already should be almost 90% ready. But in Nigeria, you have already exhausted the budgetary allocation. Yes, the project is just at the drawing level. So, to ensure accountability in this area, we should be able to have a new form of budgetary system. And this will go a long way in helping government to achieve that.
What form of budgetary system would you advise?
I've said program-based budgeting.
All right.
Program-based budgeting. In your own office, in your own radio station, if you budget that you want to spend 20,000 on traveling in a week. At the end of the week, you bring a record of what you have spent. Your boss will ask you, where did you go? How many mileage did you cover? Who are the specific customers you went to meet? And what did you achieve with the 20,000 you claim you have spent? But in the presidency, there's nothing like that. They tell you they're going to spend 200 million on salary. Even they look at the budget of the National Insurance Authority they're going to set up. Over 70% will be overhead costs. And how do you account for overhead costs? They are never related. Overhead means they are not direct. They are not related. So government itself has a lot to do. But the truth I have said is accountability is very important.
Very well
It's
said.
not about the payment. Even you ask Nigerians to be contributing 10,000, a lot of Nigerians will be glad to contribute. I have one of two of my children that are outside Nigeria as students. It takes less than 30 minutes for someone to leave his place in Bristol and get to London. As a student, how much do they pay? But in Nigeria, it's not like that. So because government is not accountable, it's not held accountable. So I think that is our problem in Nigeria.
All right. Very well said. Mr. Israel Akinwesi is a chartered accountant and the past chairman of the Institute of Chartered Accountants. And he's a lead partner, Sterling Partners and Co. Thank you so much for talking with us this morning. We really appreciate your time. Thank you so much.
But I wish you the best of luck. And I wish Nigeria the best of luck.
Amen. Thank you very much for that one.
Okay,
this is where we would have to drop the anchors on the program this morning. Thank you to our callers and thank you especially to those of you who sat back to listen to the conversation this morning. Business News is up next, but before then, your queen is in the studio, ladies and gentlemen. Olije with the hair.
Hey, Becky with the good hair.
What do you call this? What do you call this?
Pony braid.
Pony braid. Okay. Pony braid. Pony long braid.
I tell you, pony braid.
Oh, good to have. How was your weekend?
Monday. My weekend was good. It was fast.
It was really fast.
It was. Wasn't it for you?
We didn't have a weekend. I'm sorry.
You come here on Saturday, but you come here on Saturday.
We spend the whole Saturday here, or literally the whole Saturday. I mean, when you're here till 1 o'clock, you spend the whole day.
And so the weekend was short for you, Sha. It was short for you. That's what you're saying.
That's what it is. What's happening on the show this morning?
Bumi's on leave.
Bumi's on leave?
Oh my God. I just wanted
What's going to happen to girlfriends?
I mean,
on the girlfriend
something
show.
will happen.
I'm sure you're going to call up to other people.
Yeah, of course. I mean, we've got that covered. And of course, we have, we're talking about allergies today on Mind and Body.
Oh, okay.
Allergies and food poisoning. Because it's